Is it against the FDA to inject Botox anywhere that isn't above the eyes? I want my bunny lines and pebble chin injected. Plus, I have this thing where when I smile, my nose pulls down, making it look bigger. The person I made an appointment with told me that she can't inject Botox anywhere below the eyes, but she could do my crow's feet, but that's it. I have never heard of that before, and I've Googled it and I can't find anything that prohibits it. She said she could lose her license. Where can I go to get this done?
Thank you for your question. You're asking if it's against the FDA to inject Botox anywhere below the eyes. And you describe in detail that you'd like to address the bunny lines, the dimples in your chin, as well as the tip of your nose drooping with Botox, but a practitioner you went to stated that she could treat the crow's feet line, but would be endangering her license by performing the Botox anywhere else. Well, I can certainly give you some guidance on this question. I've been a practicing cosmetic surgeon for over 20 years in Manhattan and Long Island. I'm board certified by the American Board of Cosmetic Surgery and fellowship trained through the American Society of Oculoplastic Reconstructive Surgery. I've been using Botox for patients since 1993, and I have extensive experience with the use of Botox in multiple areas of the body. For clarification, the FDA does not legislate how physicians practice medicine. It's that straightforward. The practice of medicine is basically guided by a state, and the FDA is intended for the determination of safety of medical devices and drugs. Now, what does that mean? Well, when a company like Allergan went to the FDA for approval for the term Botox cosmetic, and although I'm not a lawyer, I can just give you my interpretation as it's been communicated to me. They got FDA approval for cosmetic purpose for only one area, and that's in the frown lines. So the glabella, the number 11s. Now, with that approval, they can market Botox cosmetic. But prior to that approval, Botox was already being used by physicians appropriately trained in multiple areas in the face for cosmetic purposes, including bunny lines, chin dimples, as well as smile lines, and for all the things that you want, including the tip of the nose drooping, which is to relax a muscle called the depressor septi muscle. That being said, I think that there may be a question about whether or not your practitioner is a physician or a non-physician offering this, but I still don't think that there's any issue with at the federal level, which is what the FDA is, but rather at the state level. I think that if you look for physicians who perform Botox in your area, you'll find that most doctors are willing to do Botox in areas that they're comfortable doing. So in our practice, we use it for forehead lines, crow's feet lines, frown lines, for chin dimples, and for a variety of things, even for underarm sweating. Botox is a remarkable drug, and it has a lot of remarkable uses. So I don't think you have to worry about violating any type of legal grounds or any law by having the treatment done. It's really having to do with the way companies are able to market their products in terms of safety and regulation from that end. But the FDA is actually prohibited from preventing a physician from using a drug in an off-label use, whether it's a drug or a device. Physicians practice medicine and are there to serve their patients. So off-label in no way, I think it's overly misinterpreted. Off-label does not mean illegal. Off-label simply has to do with the safety and the process that a company went through in order to get an approval. But certainly it is common practice for physicians, in this example, using Botox off-label when you think of the one area that is approved, which is the glabella. So the practitioner that you went to who was comfortable with doing the crow's feet lines was already working off-label. So from that respect, with due respect, I think that you may need to find someone who is a little more experienced or is a little more established, so and comfortable, certainly, because you want to get the dosage and delivery process right. Botox is not a generic procedure, no matter how much people try to commoditize it. There is an art to doing injectables, and that's just a side note for you to consider when you find the right physician to help you with what you want. So I hope that was helpful. I wish you the best of luck. Thank you for your question.